Dr. Jael Nekoye, a general surgeon working in Nairobi. Today we'll be covering breast cancer awareness. As you all know, it's Pink October. The symptoms that one would have in the case that they have breast cancer would be a painless lump in the breast, and sometimes the lump can be increasing in size or just remain the same size. The other symptoms that one can experience would be nipple discharge, or also changes in the skin color and the skin texture, or presence of a swelling in the armpit. This can be also manifested with a swelling around the region of the neck. And in advanced diseases, one would have other symptoms like yellowing of the eyes or difficulty in breathing. So the symptoms really depend on the stage at which the disease is at. Then the category of patients who are at risk, there are those factors that you can modify and those factors that you cannot modify. So for the factors that you have nothing, that are not under your control, it would include being female. Advancing in age is also a risk factor for breast cancer. Other factors would be exposure to radiation to the chest wall for either breast cancer or treatment of other conditions. Other risk factors that one can have would be obesity, excessive alcohol use, also exposure to hormonal contraceptives, and also hormonal replacement therapy in those who are in menopause. Other risk factors would be an underlying breast condition that puts you at risk of developing breast cancer. There are certain myths or things that have been assumed to cause breast cancer which do not necessarily cause breast cancer. One of them is using deodorants and antiperspirants. The main reason why people think that they cause breast cancer is because they have a composition of aluminium, which then blocks the sweat pores, which prevents one from sweating. So it was believed that when you hinder sweating from occurring, then you hinder the toxins that would cause breast cancer from being released from the body, which is not true. And also the other factor that one would believe that is that aluminium would act like estrogen on the breast tissue, which would then increase the growth of breast cancer cells. So there is no study that has shown whether the antiperspirants or deodorants cause breast cancer. So that is not a risk factor for breast cancer. Another myth would be the use of underwire bras. The reason why people would think that would cause breast cancer is because the bras sometimes, if they are not fitting well, they can cause pain and swelling. And as I mentioned earlier, these are some of the symptoms that one would experience if they have breast cancer. So irrespective of the type of bra that one uses, that does not put one at risk of breast cancer. As I'd also mentioned, use of hormonal contraceptive pills puts one at increased risk of getting breast cancer, and also that has been confirmed, and I think one would then return to a baseline risk after stopping the pills for about 5 to 7 years. Also, obesity contributes to the development of breast cancer, and that's why, as one of the preventative measures, is ensuring that one eats properly and also exercises to ensure that their weight is within the required range. Regarding prevention, this falls under screening for breast cancer. So screening begins at about 25 years of age, and at this age it's recommended that you get screening of a complete breast evaluation at least once in every 3 years. Once one reaches the age of 40, it's advised that you get an annual mammogram, and from 40 to 54, you get an annual mammogram. From the age of 55 up to 74, you can get a mammogram every 2 years. For those who are under 40 years of age, in terms of assessment, one would get a breast ultrasound in case any abnormality has been detected on the breast examination. So of importance is also to practice self-breast examination to be able to detect presence of any lump or any change in the breast tissue from an early age or from the time an abnormality develops. Once a mass is detected, either on your self-breast examination or when you're at a healthcare provider, the doctor will then inquire a few questions from your history, mostly looking out for the risk factors for breast cancer and also assessing the presence of symptoms for breast cancer. The doctor will then perform a physical exam to either confirm whether there is a lump or not, after which imaging will be done. So if one is less than 40 years old, most of the time one starts with a breast ultrasound. If one is above 40 years old, the first test would be a mammogram, after which the doctor would then, depending on whether the imaging, either the ultrasound or the mammogram looks suspicious, the doctor will then be able to take some tissue that goes to the lab for detailed assessment, which is called histology. Once the histology has been done, we'll then be able to come up with a diagnosis, whether there is breast cancer or not. If one is diagnosed to have breast cancer, then there are certain more tests that will be required, a CT scan of the chest, abdomen and pelvis, just to stage the disease, because sometimes one might be found to have breast cancer, but it's at an early stage. So the only way we can tell the stage depends on the further tests that are done. If the results from the histology are not cancerous, then the doctor will be able to advise you the frequency of screening and subsequent assessments. So that's what would cover under screening, and once, if a lump is found, that would be the pathway of treatment. So the doctor will take a history and examine you, some imaging would be done, and some tissue will go to the lab for complete diagnosis. The things that you can do to protect yourself from breast cancer would be exercise and proper diet, as this would prevent obesity, which has been noted to lead to an increase in the risk for breast cancer, because the excessive fat deposition in obesity leads to increased estrogen, which then now increases the growth of abnormal cells in the breast tissue. Another thing that one can do to prevent or protect themselves from breast cancer is avoid alcohol or minimize the intake of alcohol, because alcohol consumption leads to cell damage, which now leads to DNA mutations in your genetics, which puts you at risk of also developing breast cancer. Another protective factor is breastfeeding. As one breastfeeds, there is production of immune cells which fight against the abnormal cancerous cells, and also during the process of shedding and generation of new cells, that has been shown to be protective against the cancerous cells in the breast tissue. Also, conceiving at an early age, younger than 30, has been shown to be protective, because the changes that occur in pregnancy and breastfeeding lead to changes in the breast tissue that protect it from being susceptible to changes that occur in cancerous cells. So those are some of the things that one can do that would be protective against breast cancer. And also early screening, early detection, which leads to saving lives. Regarding the family history of breast cancer, presence of other cancers which can also be linked to the development of breast cancer are also important, such as ovarian cancer, prostate cancer, pancreatic cancer. These cancers have also been noted to have an increased relation to the development of breast cancer. So yes, we're focusing on breast cancer, but there's also the presence of history of other cancers which can put one at risk, because the underlying genetic mutation might most likely be related amongst the cancers that I've mentioned.